I'm going back to your original assertion that the scale is there, that you measure your success by the clinical improvement of the clinical care. But if
Exactly.
AI does not add to that one,
Why would you do it?
why would you do it? Hello, welcome to one more episode of Unlocking the AI Advantage podcast. And this is your host, Ramesh Danta. And this episode is also coming from Vive 2024 show floor in Los Angeles. Today, we're going to talk to Jim Hickman, who is with ScaleHealth, which is an innovation marketplace. And by the way, so I ran into ScaleHealth on the show floor. So I myself don't know much about ScaleHealth. So Jim is going to walk us through what ScaleHealth does and how they're actually spurring the innovation in the healthcare space with their marketplace. So Jim, welcome.
Thank you very much, Ramesh. Really glad to be here. Vive is pretty exciting. So just to maintain one contact in the middle of a hallway gathering is pretty impressive on your part. So let me tell you about Scale. We've been around a couple years. And like many good ideas, we came out of what we saw that was not working coming out of the pandemic, right? We saw a lot of companies struggling to find nimble partners that could bring emerging technology to really give people better access to care.
Okay.
So Scale took that concept and like many good startups, refined it. And so now we really are a marketplace for innovation. And what do we do? It's pretty simple. We're bridging a gap. There's a gap between leading healthcare organizations and the emerging health tech companies that surround us in this pavilion today, right?
Okay.
There's a lot of ways you can close those gaps. And there's a lot of ways you can declare success. For Scale Health, our measure of success is pretty simple. We must have clinical improvements from all our engagements that really meet the commercial needs of our health tech company partners, of our large hospital systems that we partner with like Chime.
Okay, so let me parse this into market, right? Whenever you have a marketplace, you're bringing two players together, at least two players
Buyers
together,
and sellers.
right? So one is the buyers and sellers. So in this case, you're bringing the startups with their founders, and then the other side is the providers. The audience may or may not know the word provider. Like we know startups and founders,
Yes.
right? So give examples of a provider. Is a hospital a provider?
So a hospital's a provider, a clinic's a provider, a government agency like your county health department is a provider.
Okay.
You may have barbershops actually that are providers. And I'm happy to talk about that example later. It's going to be relevant to one of the most exciting partnerships we announced while we're here this week. So it really comes down to how do you help these organizations source reliable partners to address their needs? So Scale does that in a very interesting way. We run what we call innovation challenges. So we'll work with a group of providers like large hospital systems who say, we have 3 to 5 different needs that we're just having a hard time sourcing, reliable, sort of verified, vetted talent to come into our large organizations and partner with. So we do a series of challenges where we'll have this group of expert panelists help us design a challenge with certain metrics to be hit by the companies.
Is there a prize money at the end of the challenge?
What does every startup need? They need a
Funding.
contract, right? So
Our contract, yeah.
Right. So out of these challenges come actual deals between emerging technology companies and leading healthcare providers, be they health plans, hospitals, large medical groups, county government, state or local government agencies, right?
Okay, so let me ask another question on this one, and then also I will try to distinguish ScaleHealth, which is ScaleHealth an accelerator, incubator?
No, we do neither of those things.
Okay.
So there's plenty of opportunities to really kind of bring companies along, right? Where you may hear a lot of critique about accelerators and incubators is like people get skilled up and ready to go, but until they get a deal that gets them the funding and the logo, it was a good educational process. So
the differentiator for ScaleHealth is that it's not about venture funding, but you're actually trying to get them the actual revenue to survive in this business.
that's why we call ourselves an innovation marketplace.
I see.
It's a market where we're trying to match buyers and sellers with certain, so we take a lot of the work, the discernment work out of that process. We use a very practical, but also pretty much pressure cooker type approach to vetting companies up front and then getting them through a challenge, which results in them getting a contract. And if a company's not ready, we have a series of ways we can work with these companies to get them what I call challenge ready, right? Because not every company is going to have the HIPAA security level that you need to work with a $3 billion health system.
Okay. So let me then talk about the workflow. How do you source the startups? Like, how do you identify? So do they apply to scale health challenges, or you go and actively look for companies and encourage them to apply? Let's start with that first.
So it's a number of different ways we do it. One is I'm proud to be an advisor to Scale Health. I'm not the only one. Scale has a broad community of former senior executives of large health systems who believe that they need to bring innovation into their former settings. So we're also out on the hunt, if you will, looking for smart emerging technologies. In addition, we have a strong track record of working with large companies who get bombarded sometimes, right? And they ask
You're
us,
like a filter to
we're
some
like a
extent.
filter in some ways, but we have a community. So you can become a Scale Health member if you're a startup, and
Do they pay to
it's
be a member?
$99 a month. Suddenly you're on our platform, accessible to all our member companies who are looking for whatever you do. So if you do AI, generative AI, you're on our list. We vet you, we help you, we give you some sort of rankings and scorings in a way that a vendor can look at you and go, wow, this company actually may be what we need, may be ready to do it. And if not, we'll also work with you. So you sort of become part of the family, right? And we're a family that's reliable. We're a family that delivers, and we're a family of real like-minded health players who are really trying to make significant change in our community.
Got it. Okay, so now they're members. And then do all members participate in these challenges?
It depends on the challenge, right? So if it's a challenge that's not relevant to your area of expertise, you probably wouldn't participate. But the exciting part of that is once you're on the list, you're on the list, right? And we do multiple challenges. So we just announced several challenges here today.
Give me an example of
An
a
example,
challenge.
so I'll make one very local to LA. We're doing a challenge with UCLA Health to do a street medicine challenge. What does that mean? There are 20 different types of provider organizations in the LA community funded by hospitals, funded by the county government, funded by health plans, all doing variations of street medicine, meaning going into the community either in mobile vans or as backpack health providers and trying to bring basic primary care to unhoused populations or people who are living on the margins. What they realized is they needed some tools. There's got to be a couple simple digital tools that could make the connectivity, the connection between provider and their back-end systems or provider and the individual living on the street easier so that we don't have to rediscover that person every time we go out into the community. So we're doing a challenge to sort of source innovative ideas for that kind of connectivity.
I see.
Right? And that's one small example. We're also doing our nursing innovation challenge, right? Nurses are the unheralded champions of coming out of the pandemic. So how do we make sure they stepped up in a way that we wouldn't have made it through the pandemic without our nursing force? So how do we, now that they're playing these expanded roles that came out of necessity, what are the new tools, innovations we can bring to their profession and they're also their work environment?
So funny you should talk about nurse, because just previous recording, I spoke to a lady from Nurse Approved. I don't know if you heard of that one. So Rebecca Love, she actually encourages companies founded by the nurses to come on to shows like Vive.
Yeah.
Yeah.
Yeah. Nurses are finally getting the unheralded recognition they deserve. They were on the front line. Scale also works with a variety of companies. So what's great about Scale is our community is broad. So we have companies that are working with street outreach to homeless individuals. We have companies doing generative AI work and in between, because what we are is a reliable place of like-minded individuals who need trusted advisors to find the right match between technology and need inside large systems. And large healthcare systems, recent events are very risk adverse. So a lot of what we do is build confidence in the partnerships we help structure, not through tipping a scale because we're investors. We don't invest. What we do is a very process of we vet companies, we put them through a competitive process with you as the end provider and end user as the judge, and then you feel good about your decision.
So actually, let's talk about how Scale makes money, because everybody has to make money. We have to survive, right? So what's the business model here?
So the business model is a twofold approach. One is that very simple membership model, right, which brings a lot of benefits to it. It's on our website. I encourage everyone to go to scalehealth.org and look at our website. You'll see that for $99, you're part of a community. You have access to a lot of resources and tools. If you fit the description of the challenges, you're invited into that. And then we also get funded to run challenges. So our challenges are sponsored.
Okay.
Right? That's how we support our architect, which is our platform that does all the analytics around the companies and the needs, right? And it's a generative model. Every time we have one more successful challenge, we bring another round of like highly qualified buyers and sellers. It's a repeatable business model because they've had success together.
How many challenges do you run per year?
So we're really ramping up. So we just announced 4 yesterday. So we're probably going to be doing a challenge a month, but it's not in the same space, right?
Yeah,
so
yeah,
we're,
yeah,
we're
different
doing it in
spaces.
various places. The biggest announcement that came out of Vive, and because I was involved in it, maybe I feel this way, but we just announced.
And again, so Vive is end of February, so that there's a people who are listening to
right.
it, so that we can date them properly. So you're talking about Feb 2024.
Yeah.
You're making a major announcement.
Well,
What is it?
on February 26th, Monday, February 26th, we announced a partnership between Chime, which is one of the primary sponsors of the Vive 2024, ScaleHealth, and the NFL Alumni Health Association to address community health needs, leveraging the incredible talent and resources of the entire NFL alumni community to be ambassadors to their hometowns about critical diseases and health issues that are not getting addressed by some mainstream
So this
approaches.
is not just LA, it's countrywide, right?
There are 32 NFL teams.
Yeah,
there
exactly.
are 36 NFL alumni chapters. And we hope to have ambassadors in every community working to address issues like diabetes, hypertension, mental health awareness, where we have, we're not going to have the Tom Brady's of Boston, but we'll have someone like a Billy Davis, who was an incredible player on the Cowboys and the Ravens. So he's a 2-time Super Bowl player. He's from El Paso, Texas.
So, but what do they bring to the? I'm trying to understand. Like, so I understand ScaleHealth, what you do, right?
Yeah.
So you are the marketplace,
Right.
And then Chime is the organization. They're bringing the
They're the
providers into the
buyers.
place, right?
Right.
So they bring.
So who's left out of this equation? The patients.
Okay.
The NFL alumni are helping us engage those most hardest to reach patients in the communities, right? Rural communities, communities of color.
How do they do that? I mean, what is their expertise in bringing the
So
patient?
their expertise is their celebrity.
I see.
Because
okay.
they're NFL players, but also their credibility, because many return, just like veterans return home to their communities,
right.
So do, oddly enough, professional athletes all kind of go back home.
Okay.
Because
are they funding it? Or,
So we have sponsors who are now going to be helping us build these, hopefully will be 32 different community challenges, right?
Yeah.
We're fortunate that a lot of our Chime Health partners are also oftentimes sponsors of the NFL teams as well. Right.
So fantastic.
So it's a wonderful blending of our expertise, which is bringing emerging technologies to leading healthcare organizations, and then their need to make sure all those innovations actually impact people. Right. How does this improve care? And so we're very excited because the NFL Alumni Health Partnership is going to give us that activation point.
Also scaling across the 32 markets, which is really good, right?
Yeah, there's some, that roadmap can be the hardest to build.
Yeah.
Right.
So, Jim, the other segment, I'm going to talk about artificial intelligence, right? So you did allude to AI a little bit earlier.
Yeah.
So let's go a little bit deep dive, right? When did the scale actually start? 2019?
2018, 19.
2019.
It sort of started as just like many things. It had a couple starting points, but this is really our banner year.
Okay. So the AI evolution has been happening in the members that are joining Scale, right? And then that's one aspect of it. Secondly, the challenges that you have, right? First, let's talk about the members. So has AI been picking up in the members? Can you talk a little bit about what
Yeah,
you're
and
saying?
I can talk specifically about a member called PredictView.
Okay.
AI has already gone through 7 or 8 stages of enthusiasm and death and rebirth, right?
Definitely. Multiple winters, they call them.
Right, exactly, right? So, but we're finally starting to see, I think, and if you listen to the conversations out here all this morning, people are starting to say, wait a minute, there's a baseline now that we feel is reliable use cases for generative AI, right?
Okay.
One of the areas, and full disclosure, it's a company that I'm working with through ScaleHealth, is a company called PredictView.
Okay.
Right? We spend a lot of time worrying about the impact of social media on our mental health.
Yeah.
I have kids. If you have kids, it can be very difficult. There's also science that says because of the use of social media, people are creating in some ways their own digital biomarkers about their state of mind.
Mm-hmm.
And that there is proven research and analysis that shows that you can do some modeling around people's sort of states of mental health wellness based upon, frankly, what they're posting on social media. PredictView is an interesting company because they've built a really interesting sort of behind the scenes back end application to help whether you're an online therapy provider, maybe you're a virtual first care provider,
Yeah.
a tool to help people do their own sort of health and wellness scorecard based upon what they're doing with social media.
So it is more for the patients or it is more for the providers?
So it's an and both, but ideally, let's use the use case for an online therapy provider. The biggest challenge online therapies providers face is, number one, early
so
identification.
there's something called online therapy provider?
Right.
So that's a new profession?
Yeah. So think like all the companies like Brightside and
you mean like somebody remote, like as opposed to me going into
right.
Not as opposed to a social media therapy.
No. Right. So think about all those companies where you can access therapy.
Yeah, got it.
Right. And these were all bundled in your employee benefits packages, right? We all have like all
Correct.
these right?
Telehealth, basically.
Basically, telemental health, right? So think of it that way. They face a very simple challenge. How do you early identify people with need for services?
Got it.
And then how do you activate them? And how do you keep them staying engaged? And oddly enough, social media and media tools have proven that they're actually good at all those things if you know how to direct them. So PredictView has developed a platform technology that integrates with those online providers.
I see.
And helps them by just simply engaging in simple conversations with individuals themselves who say, I'm willing to let you look at my social media posts. You can come back and say, hey, here's your sort of your self-awareness card. Here's your social media report on what you're seeing. Boy, you posted some things that look like you were having some difficult times.
Anxiety,
and it sort of gives them some opportunity to reflect and maybe then decide, wow, maybe I should talk to somebody.
Not only that, it gives a good triaging information to the healthcare provider.
To both the provider to say, wow, in my panel of 2,000 patients, these folks are showing signals that I may want to check in on.
Yeah.
But it also gives the individual the power first to say, wow, the first step to any recovery is admitting you have a problem.
Exactly.
Right. So
being aware of it.
Being aware of it. Right. So it gives them that awareness. And then you just are then syncing up with these existing good tools that are out there for care. But if you don't engage with the tool, it's just another tool.
That's a great example, actually. So the last question, Jim, on this one is, are you thinking about any AI-focused innovation challenges going forward? Do you have any? Are you thinking about? Are you planning any?
All I can say is that clearly it's a hot topic.
Okay.
It's something that we are very interested in, and we're certainly engaged in a lot of conversations. It's a little bit like the conversation outside this room. So where would you start? Where would you pick, right? And so that's kind of what we're hoping to leave here.
It could be like an AI-focused online therapy. I'm just giving an example.
You're right.
Right?
Exactly. Right. So what we also do in these settings is we do a lot of listening.
Yeah.
And see where's the emerging need? Where is there an emerging technology that's going to help solve a need from our friends at Chime or some of these other organizations who come to us because we're experts with broad reach and say, hey, we're thinking about generative AI, but we don't know if it's a claims-based play over here or is it a patient engagement play over here, right?
Because I'm going back to your original assertion that the scale is there, that you measure your success by the clinical improvement of the clinical care.
Exactly.
If AI does not add to that one,
why would you do it?
Why would you do it?
Exactly right. So that's how we keep ourselves from doing things that aren't meaningful.
Okay.
Right. That's our high bar. So if we're not driving clinical improvement and building really our improving care delivery, then why do it? So back to the NFL partnership, why are we doing that? Because we think we can change the way care is accessed and delivered in some of our hardest to reach communities. It's a novel approach, leveraging local celebrities, right?
That's fantastic.
But you know what? They're the activators. They unlock community.
Yeah.
Then we bring the resources that the community hasn't had access to, right? And if you're a startup company, you're excited to say we move the needle on disease state X or patient population Y. It's a win-win.
Excellent. Hey, Jim, thank you very much. We have now better understanding of scale. So is scale just not a LA, it's a scale.
Oh, no, we're international.
And then you proved it with the 32 NFL markets that are there.
Knock on wood,
Knock
right?
on wood,
yeah.
Hey, good luck to you.
Personally, I'd love to be able to say I went to all 32 NFL stadiums, so that's a small benefit
to me. So
that's
our benefit, exactly. Yeah, all right. So hopefully you will get a chance. So with that, thank you very much, Jim.
Thank you very much. I appreciate it. Thank you now.
Take care.